Today, I'll be discussing the topic of cultural competent assessment and its importance in multicultural counseling, as well as its essential elements and my personal evaluation of how it's presented in our course materials, wrapping up with a final conclusion. What is culturally competent assessment? Culturally competent assessment is the process of evaluating clients in a way that considers their cultural background, worldview, identity, values, and lived experiences. According to Daryl Wing, Sue, and colleagues, culture strongly influences how people communicate, express emotions, and experience mental health concerns. Because of this, counselors must move beyond standardized assumptions and assess clients within their unique cultural and systemic context. Sue et al. Emphasizes the importance of multicultural knowledge and awareness, multicultural awareness and cultural knowledge, and counseling skills to reduce bias and improve accuracy in assessment. Additionally, Thaddeus J. Williams highlights the importance of recognizing the inherent dignity and worth of every individual from a Christian counseling perspective. Culturally competent assessment should not only address cultural and systemic influences, but also affirm the value of each person created in the image of God. Together, these perspectives support ethical, respectful, and holistic counseling practices. Culturally competent assessment is critical in multicultural counseling. Because traditional assessment tools were often developed based on Western norms, which do not apply equally to all populations. Without cultural awareness, counselors may misinterpret behaviors or symptoms. For example, emotional expression varies across cultures. What may appear as avoidance or resistance could actually be a culturally appropriate form of communication. Additionally, culturally competent assessment strengthens the therapeutic relationship. When clients feel understood and respected, they are more likely to engage in treatment. From an ethical standpoint, both the American Counseling Association and American Association of Christian Counselors emphasize the importance of respecting cultural diversity, avoiding harm caused by bias. Ultimately, culturally competent assessment allows counselors to see the client holistically, including culture and social systemic influences. There are several essential elements that make an assessment culturally competent. First is self-awareness. Counselors must recognize their own biases and assumptions. Without this awareness, those biases can unintentionally influence interpretation. Second is cultural knowledge. This includes understanding the client's cultural background, values, traditions, and communication styles. However, it is important not to stereotype, but instead approach each client as an individual. Third is to use appropriate assessment tools. Many standardized tests are culturally biased, so counselors must evaluate whether the tools are valid for the client's culture group. Another key element is contextual understanding. A client's behavior cannot be separate from systemic influence, such as discrimination, socioeconomic status, or immigration experiences. Flexibility is also crucial. Counselors may need to adapt their approach rather than strictly follow standardized procedures. Finally, collaboration with the client ensures that their perspective is included in the assessment process, empowering them and improving accuracy. Together, these elements help create a more accurate and ethical assessment process. I agree with the author's emphasis on cultural awareness as a foundational skill in assessment. As discussed in Counseling the Culturally Diverse, understanding the client's worldview is essential for accurate assessment. I also agree that assessment tools must be adapted or carefully selected to avoid cultural bias. This aligns with the ethical standards that call for competence and fairness. Additionally, the author's focus on systemic and contextual factors is important because individuals do not exist in isolation from their environment. However, one limitation is that the discussion can feel somewhat theoretical and may not provide enough practical guidance for counselors in real-world settings. From a Christian counseling perspective, Thaddeus Williams, I would also argue that integrating a client's spiritual worldview is an important part of truly holistic assessment. Overall, while the author provides a strong framework, there is room for more applied strategies and integration of faith-based perspectives. Final notes. Culturally competent assessment is a vital part of effective multicultural counseling. It reduces bias, improves diagnostic accuracy, and strengthens the therapeutic relationship. Counselors must continuously develop self-awareness, expand their cultural knowledge, and remain flexible in their approach. Ethically, counselors are responsible for providing care that respects each client's cultural identity and lived experiences. When well done, culturally competent assessment supports holistic care and promotes meaningful, effective counseling outcomes. These are my references.